No, last time we saw a case of cirrhosis of liver. You remember? We tried to understand some homeopathic principles in that case. So today we'll see another case. This is a case of a 7-year-old girl who comes with recurrent infections, throat infection, stomach infection, tonsils infection, and adenoid. So she cannot breathe with the nose. And she has been advised, what? Surgery. Very good. So, what to do? The main story is that when somebody has recurrent infections, so the problem is not in the stomach or in the throat or in the tonsil or in the adenoids. The problem is in the immune system. Low immune system cause recurrent infection. So we have to correct the immune system. But you know very well from last time that immune system is connected with endocrine system, nervous system and the mind. They form an axis, psycho, neuro, endocrine, immune system axis. And in each individual it is different. So by studying the symptoms of the mind, the nerves, the immunity and the endocrine system, we get an idea of what is that disturbance at a deeper level. And if we can correct that, then everything changes. How do we do that? So little bit we'll talk about the process. The first thing is, what we do is we give here in Other Song Academy and in my clinics, we give the patient a questionnaire form or a case record form. This case form is about 30 pages long and it contains questions about past history, family history, about likes, dislikes, about sweating, about menstrual function, about all the different factors that affect that individual in a positive or negative way, about the dreams, about the state of mind, etc. So what we do when we get that case record form, we scan the form. We look through the form to see where is the individuality of this person. What is it in this form that stands out? In this way, the first thing we note is the background. What is the name, the age and sex, what is the occupation? So before we know the individuality, we have to set the background, because the individuality has to be judged in view of the background of that person. Then we see the past history or the medical history. What are the things that happened before? What is the origin, duration and progress of this illness? But what is even more significant are two factors. One is the exciting factor. What is it that aggravates or triggers off this person's problem? Because the triggering factor or the exciting factor must be that to which the individual is most sensitive. So you straight away understand his deepest sensitivity by the triggering factor. That is the individuality of the person. Then we have to see what are the peculiar things, the cravings, the aversions, the sleep, the sweat. What is peculiar in all this? So I am giving you the website of the Other Song Academy. It's www.theothersong.com, and you can go there and the case form is there. It's available. You can download, you can use it, you can see it, and there's no copyright. You can use it on your own patients. Then when you scan the case record form, you see what is the hot spot. That means where seems to be the individuality or the energy of the person. What is it I see here that I rarely see, I don't see very often? This way. So here you can see in this case paper, we have asked what are the main complaints, and the mother has written frequent infections, persistent infections, especially of the ear, nose, throat and stomach since the child was a baby. Infections happen cyclically, one after the other, and need antibiotics to subside. The child has a blocked nose and ear problem, low hearing, sleeps with the mouth open, breathes with the mouth, snores when sleeping, can hear a nasal twang in the voice, and there was an ear infection with rupture in the eardrum and with discharge, otitis media. Thick, whitish nasal discharge that builds up every day despite steam, cleaning and blowing the nose. So these are the issues. And diagnosis is of adenoids and surgery advised. And you can see in the past history, throat infection, ear infection, stomach infection, frequent, everything cold and cough frequent, molluscum contagiosum, another viral infection. So, antibiotics taken very often underlined. All this, genticin, distaclor, cepodem, augmentin, keflor, all kinds of antibiotics. So what are the antibiotics doing? Just taking care of the current infection, doing nothing to the immunity. There is no medicine in modern medicine that can prevent the infection. Okay. So she writes, cough and cold, very often, in fact perpetually, child has a cold and a blocked nose. Thick, whitish, slightly smelly nasal discharge that is sticky. Voice is nasal, breathes with the mouth open, especially while sleeping. Then there is a section in the case record form about the mind state of the person. And here she writes, what are you anxious about? And the top is written illness. This is interesting because normally in a child you don't get so much anxiety about illness. Then what are you fearful of? Dogs, animals and dark. What are you suspicious about? New types of food. So she liked to stay with what she is familiar with, don't want to try anything new, don't want to go in the dark, don't want to face an animal. How seriously are you affected by disorder and uncleanliness? Likes order, likes clean rooms and dry floors. What are the greatest grief that you have had in your life? And you see there illnesses. What you don't like to do? I don't like studies. Very rare symptom, isn't it? So the idea is, against the background of the childhood age, we have to judge what is common and what is peculiar. So don't like studies, I think must be very common, isn't it? Even at my age, I don't like studies. Then the dreams. So you see dreams of cats and dogs, robbers, thieves, storm, shooting, flying, snow, pleasant, failure in exams, parties. In the case form also, we ask them to draw something. In adults, we ask them to draw a pattern that does not have any sense or logic, so that the spontaneous inner energy pattern can express, like a doodle. But in children, we ask them to draw anything that comes to mind, and you can see here there's a nice happy birthday party and a lot of fun and all kinds of things going on. I think there's a cake there, and people with those birthday hats, and that kind of corresponds with the dream of parties and the dreams that are very pleasant that we see here. Okay. Now, after this case record thing, the patient fills it out and comes to us, then we start our questioning. We do not depend upon the information given in that case record form. That is just the starting point, the identifying point as to what is going on. And what have we identified so far? We have identified 3-4 things. Number one, that the child has low immune system, tendency to cough and cold. The main location or the site of action, adenoids, tonsils, ear, isn't it? What else we know about the child? Child is a fearful child. Even the dreams you can see dogs, cats, storms, thieves, robbers. And what else we know about the child? Will not try anything new. Will stay with the familiar. So what have we understood so far? We have understood the general background. What kind of remedy are we looking for? One with a low immunity, recurrent cough and cold, whose action is primarily on adenoids, nose and throat. A fearful child who doesn't like the unfamiliar. This is what we call as the genius of the case, the type of case that we are looking at. So basically in our analysis, we look at 3 different things. The first is the type of case or the type of patient should match with the type of the remedy. And what is meaning of type? The general location, the general pathology, the general age group, the general mind state, all general. That should match. Then the second thing we match is what we call the symptomatology. And here we will identify the symptoms. So in the chief complaint, in the narration, in the case taking that we do 1-to-1, we try to identify the details of the symptoms. So here we see frequent infections in the throat, ear and nose and stomach. Stomach infections that remains for 3 to 4 months. She vomits when traveling. Ear infection is very common, has adenoids, keep the mouth open. The sleep is uncomfortable. In the food, you see aversion to sweet +3 means very intense. Is it strange or common? Strange, especially in children. And craving for egg, 2 marks. So these 2 marked symptoms of the nervous system. Nervous system is the one that is sensitive to cravings and aversions. Taste is a nerve function. So when I read this kind of notes, what I do is I start circling the individual symptoms. So craving for egg, I have not circled aversion to sweet, I should have. But we have taken it into account later on. Then the sister loves the dog, but I don't like it. When they bark, I feel they will bite. I get scared of snakes. I feel they will bite me. Even the python I get scared. I can't even watch it on television. And I'm very sensitive to a story where an evil man was there. He had a cruel sister and they did all kinds of nasty things to people. So, now you mark it out. What do we see here? Dogs, snake, bite, scared, evil and cruel. This is the mind sensitivity. This Now, on the general, we can say it's a fearful child, but at a particular level, we know exact fears: dog, snake, bite, evil and cruel. And these are specific symptomatology in our materia medica. Exactly it's mentioned in remedies. Then, she is very cautious. Plus means very intensely cautious, very careful. She doesn't want to play freely because she is afraid she may get hurt. When she goes on a cycle, she'll be very, very cautious. You know, there are children who are quite reckless. Parents have to caution, hey, don't do what the child is going. Look, mommy, no hands, isn't it? One joke is there. First he said, look, mommy, no hands. Then he said, look, mommy, no feet. Then he said, look, mommy, no teeth. Children can be reckless. But this child is very cautious. She is afraid that she will fall, she will get hurt. Very careful, 2 times. Mother feels maybe she is very careful because her pain threshold is very low. She cannot bear pain. She is very afraid of pain. And because she cannot bear pain, therefore, she doesn't like to get hurt. And therefore, she becomes very careful and cautious. Then, see, she has got offensive sweat, which is more on the head, and sweat generally has a very bad odor. So now, again, we have some circle, cleanliness mania. The child will not go into the bathroom even if it is a little bit wet. Mother has to clean the bathroom before she goes. Very cautious, fear of falling, careful, fear of pain, offensive sweat on the head. Then, there are 2-3 things in the case that are not mentioned. That has to do with her sister. There is some jealousy about her sister. She feels the mother is giving more attention to the sister. And there are such other things which we kind of, if I can get it, I'll try. Because it is also important what we didn't take in the case. So you see here, this is the actual case, as you can see, that was taken. So here she says, my sister teases me, I got angry and I scratch her. They say she is a quiet kid and very talkative. Little contradictory, no? So the contradiction is as follows: very quiet outside, very talkative inside the house. When she is unwell, she becomes very quiet and wants to be held. I love playing hide and seek, but everybody keeps following my place and they know which is the place I hide in. Then there are boys in the vicinity who always keep fighting. There are children in the school who are irritating. They are so stupid. Now these things that we read, very important to understand, these are very common in children, isn't it? So you have to judge the individuality and the peculiarity of each symptom, especially by its intensity and by in whom it is found. This is the most important thing in homeopathy, because if you give importance to the wrong symptom, for example, if you take this symptom, I get angry and I scratch her, and you give it a lot of importance, you have missed the case. Because the intensity is not so much. These are common between children to fight. How intense it is. Does she get on her hands and knees and scratch the hell out of her? That's another story. Then it would have been mentioned, described like that. So what makes a symptom important? Its intensity, its peculiarity in a given circumstance, and especially when it is qualified. She gets angry, she hits, not good enough. She hits so much that she punches and punches and punches in the nose. When something is that qualified, then it is important. Are you with me? So you've got to learn to ignore common things and give importance to peculiar things. So, what is this? Snakes. So scared of snakes that I see that on the TV also I get scared. The sister is very happy, goes and pets all the dogs. But I can't do that. And the same thing in the dreams of cats and dogs. So when you see something is repetitive, something is intense, something is qualified, becomes much, much more important. So, hobbies, reading books. Mother says she reads books which are not meant for her. And then some stories. She also is very short-tempered and gets angry. She has got some sibling rivalry, some jealousy of her sister. She likes to be flattered. Very observant, wants to know about everything, very cautious, sweating, sleep position, etc. Then we also ask the mother's history during pregnancy in children. Very, very important. If the mother had intense state during pregnancy, we find very often the child almost always has the same state, needs the same remedy of the state of the mother in pregnancy. But in this case, we see that she was very busy, she hardly cared, thought about the pregnancy. She felt there was a lot of responsibility on me because my husband was not there at that time. So we examine and we find enlarged tonsils, we find wheezing, hearing is a little bit lost on the left side, and so forth. So that's the whole case. So, now analysis. Now in analysis, what we can simply do is to take the symptoms. Very simple. We see in homeopathy every symptom has got set of remedies. And by seeing which remedy has all of the symptoms of the patient or most of them, we are able to identify the remedy. So here, aversion to sweets, desire for eggs, sleeps on the abdomen, horrible things, sad stories affect her profoundly. Careful, fear of dogs, fear of snakes, fear of pain, and head sweat offensive. So what have we done? We have not taken one symptom of the tonsils or adenoids or anything. No local symptom, only symptoms of the mind, of the nerves, of the cravings, of the perspiration, means symptoms of the psycho, neuro, endocrine, immune system. The symptoms of the individual. And we are able to get remedy Calcaria carbonica, calcium carbonate. The problem in homeopathy is not to find the remedy. That is easy. The problem in homeopathy is to be sure of the remedy. That is difficult. Yes or no? Yes. Anybody can guess the remedy. Oh, it's Calcaria. Oh, it is pulsatilla. I think it is so and so. Very good. But is it? Are you sure? Can you bet your life on it? Oh, I don't think so. But you can. And that's what the synergy approach is about. What is synergy? The idea of synergy is that we take the same case, we look at it from three angles, like three angles of a triangle, looking towards the center. The first is the symptomatology. The second is called the genius. The genius, as we said, is the type of case, the type of pathology. What are the things in the genius? The location, the pace, the pathology, the general state, the constitution, the general mental state, not the mental symptoms, but the type of person. Is it a timid person, fearful person, anxious person, angry person, depressed person, quiet person, talkative person, excited person? The age group and the gender, the pathological general. In this way, we are able to say. And for the genius, the repertory that we use is usually Phatak's repertory, because it is based on Boger's approach. And Boger is a homeopath who understood the idea of genius very thoroughly and incorporated in his book called Synoptic Key. And from that book, Phatak repertory is created. So now we can see, if we take in Phatak repertory, cold tendency to take, pathological general, location, adenoids. The discharges that she had from the nose were described as milky. So we take discharges milky, general, pathological general. Then the type of person, cautious or careful, yes or no? So when we take these four, the genius of the case, again we land up with the same remedy, Calcaria carbonica. So whether we take from a symptom angle or from the type of person, same remedy. Now, when we look at Phatak repertory at the rubric adenoids, you find here 6 remedies, 3 of them are Calcaria. So you can imagine how strong Calcaria has affinity towards the adenoids. The last side of the triangle that we look at is called the system. What is system? System means the experience of the person classified into mineral type, plant type, animal type. What do we see in this child? We see that there is a feeling of insecurity. I am afraid. I have to be careful, cautious. I cannot face a dog or a snake or a pain I need to be protected from external harm. I dream of robbers, thieves, storms, cats, dogs, biting, falling, pain, injury. So I need something to protect me. This feeling of I need something is a very, very mineral quality. They need a structure. They feel lack of that protective structure. A plant kingdom person has the main experience of sensitivity. Things affect me, things hurt me. Oh, this child is very sensitive. You tell her one thing, oh, she starts crying. You oh, she's so hurt, she's so affected, she's so sensitive. You have to be very careful with what you say to her. Whereas an animal type, very competitive. She always wants to get ahead of the others. She wants all the attention for herself. So here you see, every child has sensitivity, every child is competitive, every child needs some protection, some this. But you have to see what is it in this child that is intense, that is out of the way, that is special. Are you with me? So, once we see here that she needs protection, She needs security. We divide the mineral kingdom according to periodic table, and we say that it has 7 rows, 18 columns. The first row has to do with the feeling of I exist. The second row is I exist within the protective covering of the mother in the womb. I am not yet out. The third row, I need love, care, warmth and nourishment. The fourth row, I need security, I need money, I need home, I need protection. The fifth row, I need to learn something new. The sixth row, I need to take responsibility. The seventh row, I need to let go. So these are the stages of life. And the fourth row, in which Calcaria is the second column, has the idea, the fourth row has the idea, I need security, home, protection from outside harm. I am independent in terms of care and nourishment. This is okay. I don't need all that. But I need money. I need a bank balance. I need good health. I need a family. I need a job. So that is where on the left side of the fourth row, the elements feel I need. On the right, they feel I am now losing. In the middle, they feel I have it. So there is a graph that goes up to success and goes down to losing. And in Calcaria, which is the second column, the feeling is I need it. I need it from outside. Protection, security. Interestingly, the Calcaria carbonica, calcium carbonate that is in homeopathy, is obtained from the middle layer of the oyster shell. And that gives us a very, very good idea of the experience of Calcaria, because the shell is the protective layer. In our body too, this is calcium, the skull, the bones. And what do? They protect the soft organs that are inside. That is the experience of Calcaria. That is a sensation. I need to be protected. I am delicate. I cannot bear pain. I cannot bear suffering. I cannot bear falling. I cannot bear outside harm. I need something to protect me. So that's where we see the experience of the child. And in this way, we see that all the three sides, the genius, the symptoms, and the experience, all point towards the remedy Calcaria carbonica. Now, you can sometimes approach it from symptoms, sometimes you can approach it from experience, sometimes from genius. But ultimately, they should all converge in the same point. So far, homeopathy dealt more with symptoms, but in the last, let's say 15-20 years, we are exploring the idea of sensation and experience to complement the symptom approach. So we look at a coin from both the sides and to be sure that we are in the right track. That is the wonderful progress that homeopathy has made. And that's what makes our prescriptions that much more definite and sure. So that is the triangle. And you see, symptoms indicate also characteristics, means what is peculiar to the individual. The rubrics means repertorial references. The keynotes, the proving symptoms, the toxicology. System indicates sensation, kingdom, the pace of the disease, which is miasm, and the very source of the substance, which gives you its experience. And they all come into the common point, which is the remedy. So the remedy given to her was Calcaria carbonica. Let us understand little bit more about Calcaria carbonica. For that, we will study few symptoms. Firstly, Calcaria carbonica usually obese patients, but I found also it can be thin patients. So let us first not have a fixed idea about the remedy. This child we saw was not obese at all. If at all medium built, slightly on the leaner side. So if you have fixed ideas about remedies, you will lose it. Usually profuse perspiration. But again, there is a rubric in Calcaria carbonica that says skin dry, inability to perspire in spite of exertion. Only 2 remedies, Calcaria carbonica one of them. So profuse perspiration as well as total absence of perspiration both indicate Calcaria carbonica. That's the reason why we should not have fixed ideas about remedies. If you want, we can see the rubric straight away, so you can believe me a little. It is given skin dry. Under that you see inability to perspire, what did I do? Wrong rubric. Dry. And then perspire cannot even during exercise. So you say very few remedies: argentum, calcarea, natramur and plumbum. I use this rubric very often. If a person says, I don't sweat at all, I also think of Calcaria carbonica. I go on the treadmill, doctor, but not a drop of sweat. Okay. So in this way, your repertory helps you expand. Now you see desire for egg, but do you know Calcaria has aversion to egg also, equally important. Very interesting. Desire for ice cream, sweets. Chocolates is a strong craving. Meat is a very strong craving. There are 4 remedies that says in Materia Medica must have meat: Calcaria, Naxomica, Staphysagra and sulfur. Cannot live without. Also, indigestible things such as sand, slate pencils, chalk, calcium. Many women in pregnancy, many children, they like all these indigestible things. The pathology of Calcaria carbonica include generally affection of bones, glands and joints. Glands also adenoids, tonsils. These are glands, cervical lymph glands. The main modalities of Calcaria carbonica are worse from ascending. Means they get breathless and weakness from ascending. It's a very, very important confirmatory symptom. When I find a remedy, I ask for these confirmatory symptoms. If a person does not get aggravation from climbing the stairs, usually his remedy will not be Calcaria carbonica. Do you know why? Any idea? The answer is very simple, that when we go to the system analysis, you find that the 4th row, which we talked about security also, is also the row of strength and stamina. Kali and Calcaria have absolutely no strength and stamina. Ferrum, for example, which is more towards the center, very strong strength and stamina, very strong. Iron. Ferrum is iron. So in the left side, they don't have it. So the main theme of Calcaria carbonica is a lack of stamina. That is the reason why ascending or exertion of any kind tremendously aggravates Calcaria person. How do we know this? Patient will come in a follow-up. Doctor, my God, I have come from so far to see you. Very tiring, doctor. Okay, where do you stay? 3 streets away. That much exertion seemed to, and that also she has taken a taxi and come. It's not as if she has walked. Even that exertion seems too much. Whereas somebody coming from America will not tell you I am tired. Very strange, no? Also, another confirmatory symptom is dryness and chapped skin in winter, especially of feet. Few remedies have this: sepia, graphitis, petroleum, Calcaria carbonica, sulfur. These are cracked skin in winter. So cracked skin in winter, worse from ascending the stairs, worse from exertion. These are very strong confirmatory symptoms of Calcaria. Let's go to some mind symptoms. Mind symptom, anticipation, dentist before going to. Who is a dentist? Basically, a sadist by another terminology. Yes or no? He delights in giving you pain. Yes or no? You must see people in the dentist office before they go into the scared as hell. And especially one or two guys inside are shrieking loudly, ah! Oh my God, my turn next. So what is the main story of the dentist? Fear of pain and suffering. The main story of Calcaria carbonica, fear of pain and suffering. Another symptom is anxiety when hearing of cruelties. There was a very good doctor in Valsad, north of Mumbai, homeopath. And he had a patient who had developed vitiligo, leukoderma. The patient gave the history. He was a child, like 10 years old or something. The sister of this child was 14, 15 years old. One day, while they were having food or having conversation in the house, this sister said, today we had frog dissection. They had put the frog, they put anesthesia, but the frog was still alive. And then when we cut open the frog somehow managed to jump out, and she was jumping all over with the intestines all out. When the child heard this, he could not sleep or eat for the next 6-7 days. The mind gets very, very, very affected by hearing of cruelty, pain and suffering. That child did beautifully on Calcaria carbonica. The vitiligo went away. What is the symptom of vitiligo in Calcaria carb? It's a very interesting symptom. You have white skin with dark borders. So around so you see here, white skin with dark border. So if you see a vitiligo with a blackish border around it, and that child is very sensitive to cruelty and to pain, just close your eyes and give the Calcaria carbonica. It's exact. And you will get very, very good results. It's a great remedy for vitiligo. Similarly, fear of dogs. What is a very interesting question to ask Calcaria carbonica is, what is your fear of dog? And almost always the answer will come, fear of injections. It's the fear of the needle that pokes, because you get so many injections. 100% you will get. The dog is not so important. So they are very afraid of the prick of the needle. So there's a rubric like that in the repertory, starting at the prick of a needle. Starting, and then you see prick of a needle from Calcaria carbonica. So they are, the worst fear of Calcaria is injections, even more than the dog. So then you have a rubric, talks of nothing but murder, fire and rat. What does this mean? This means danger, isn't it? And danger from where? Murder is danger from the humans. Fire is danger from nature. And rats is danger from the animal kingdom. So danger in any form, whether it be from nature, from fellow man, or from animal kingdom. So you see, the whole theme of Calcaria, no stamina, no protection, no security, danger all around, fearful, very, very scared. And therefore, when you see, again, when you go to Phatak repertory, so in Mac repertory, you have choice of so many repertories here, and you can choose what you like. You go to Phatak repertory, and then you see here one rubric, children, and under children, you see one rubric, afraid of everything, Calcaria carbonica. When you have fear of everything, when the specific fear, go to that. But fear of every damn thing is Calcaria carbonica. The most fearful children you can meet. Then, what are the other symptoms? Vertigo from high places. One of the strongest confirmatory symptoms in almost every case of Calcaria carbonica, what happens when you look down from high place? He or she should say giddiness. 90% will say. Another symptom in women, metrorrhagia from fright. Means when they get frightened, the mind, hormones start working. So they get bleeding out of turn. Another symptom is tendency to formation of stones. You know, calcium. There is gallstones, kidney stones. Tendency to the formation of stones can be removed by Calcaria. Another symptom is they cannot tolerate tight clothes. Loosening the clothes. You can ask 100% Calcaria will tell you, how do you tolerate, how you like your clothes, tight, loose, does it make a difference? Yes, doctor. Don't ask leading questions. You can't tolerate tight clothes, no? No. Does it make a difference if your clothes are a bit tight or loose? Yes, no, doctor. I cannot tolerate tight clothes. Another symptom is religious ideas in children. Small children, 5 years, 8 years, praying. What do they pray for? Answer me. Protection, security. The mother and father said, anything you are afraid, God will protect you. So they are religious. So there is a symptom here in the Materia Medica. What is the symptom? Very, very good symptom we have. Religious, under that, religious affections in children. You can see Calcaria carb and stramonium. But under that is a rubric, wants to read the Bible all the day. Calcaria and stramonium. What does it mean, want to read the Bible all the day? Bible means your own religious book. May not be Bible, maybe Bhagavad Gita or Hanuman Chalisa, most probably. Huh? Hanuman is the protector, isn't it? Hanuman and Hanuman more or less the same. Both protectors. Just different name. So, they hold on to the holy book that it will protect them. What is the difference between Calcaria and stramonium? The difference is that in Calcaria, they try to prevent the danger. And in stramonium, they are perceiving the danger. This is stramonium. Active fear. It's happening in the moment. It is acute. So when a Calcaria gets into a frightful situation, he may need stramonium as acute remedy. Very often we find. I want to mention one very nice rubric from which I learned from Segal. And that is, he pointed to the rubric. One woman come and said, Dr. C, I have osteoarthritis. This is a very favorite pathology of Calcaria carbonica. Why it is? Because affection of bone and joints usually affect obese people, isn't it? And thirdly, what does it do to the person? Makes them very slow, cannot exert. All these are Calcaria qualities, right? So one patient with osteoarthritis came and told him, "Doctor, listen, I have got pain in the knee joint. I have heard that homeopathy sometimes increases the pain before it decreases it." Of course, this is totally nonsense, but some people have this whole concept. So he said, "I have heard. So doctor, don't give me any medicine that will make my pain more. I don't mind if the pain, my problem doesn't go. That is okay. I don't want to be cured. That is okay. If you cannot cure without increasing the pain, I don't want to be cured. But just make sure that it doesn't increase." So what he did, he took the rubric indifference to recovery. Indifference about his recovery. And then fear of suffering. Are you with me? So I don't mind if I don't recover, but don't make me suffer. So you see here, fear of suffering, fear of pain. See, fear of pain and indifference to recovery. So in this way, he understood. And I find this very useful in my practice. Doctor, I am okay with what is. I don't want to suffer, that's all. ठीक नहीं होएगा चलेगा, लेकिन इससे ज्यादा ना हो जाए. Let it not be more than this. That's it. So in this way, we can understand some things about Calcaria carb. Now, how to select the potency in this case? Potency selection depends upon the levels. So we divide people into their level of experience. Is their level of experience only at a pathology level? Only my diagnosis, doctor? Or do they have local symptoms? Or do they have mainly emotional symptoms? Or do they have symptoms of the psycho-neuro-endocrine immune system? Or do they have symptoms at an experience or sensation level? So in this way, we are able to decide which potency they need. In this case, you see, all the symptoms are of psycho-neuro-endocrine. She has low immunity, she has all the cravings, she has definite mental symptoms and dreams. So this is level 4. And because her condition is constant infection, we give her a constant potency, that is LM or 50 millesimal scale, 8 potency, that corresponds to level 4. And this potency was given to her on a daily basis with succussing. So that was what was given. Calcaria carbonica, 50 millesimal, 8 potency, daily doses over a prolonged period of time. What happened? After 1 month, immunity much better. Energy levels good. Immediately she started improving. The intensity and frequency of her infections went down. So the medicine was repeated. After 6 months, she is doing well in everything, in academic, in sport, her appetite is better, cold cough. So person as a whole improves emotionally, physically, energy wise. That is the beauty of homeopathy. And then after 1 year, she had an acute episode. During an acute episode, we decide, does she need the same remedy? Means, does she have the same mind and body symptoms or different? In this case, it was same. So 1M potency, 1000 potency was repeated during the acute. And once the acute is over, we go back to LM potency. If the symptoms differ, change, we have to change the remedy. So in this way, we see that she did very well. And in fact, few months ago, we said to the mother, child doesn't need any treatment. She has no problems at all. So they are very happy with it. So it's a good idea to hear the mother's experience of what happened.
I think I brought my mother-in-law here. I brought Anoki was the next person. And just yesterday I was here to also find some help for my father-in-law. So in fact, I'm thinking of taking this once-in-a-lifetime opportunity to ask Dr. Sankaran to create a family plan or a Parivar Yojana scheme, okay, at Sankaran's clinic. I think it would be a super-duper success. And, you know, that itself, I think, is a big testimonial to the role that it has played in our lives. Dr. Faiza has asked me to speak about Anoki's case a little bit more, but each of us have had our own experiences, so that would turn into a 2-hour session, so let me not go there. Let me stick to, you know, my experience as a mother and with Anoki's case. So Anoki, from the time she was a baby, has had so many frequent colds and coughs that, she had to as much as look at an ice cube, to develop cold, cough, and all of the associated symptoms. In fact, it pretty much overshadowed, many years of her growing up. And it used to never go by itself. Neither my husband nor I have ever been paranoid parents. We were not brought up in families that were paranoid either. And we never ever thought that we'll reach a point where we'd be telling our kids not to eat this, or not to look at that, or to be careful when they went for a school picnic. And we found ourselves saying all of this for the first 5, 6, 7 years of our life. And it turned us into people we didn't want to, sort of really be. But we used to see that her, it used to never happen that she would have something cold or be in an AC and wouldn't have a cold cough right away. And it would not go without antibiotics. So the number of antibiotics, I think she's had quite a bit. And it used to bother us because we didn't think that that was the way in which, a child's life should go. But we didn't exactly know at that point what we should be doing. And I think associated with all of these were some other issues. When children get a lot of cold and cough, they also have ear issues. Also, there is, minor loss in hearing because there's fluid which goes in. She used to have a nasal tone while speaking. So a lot of things connected to this. And in general, we used to always have a feeling that her immunity was shot to bits. A general feeling that, the immunity is not up and about like how you would want it to be. The problem got a little acute, I think, maybe a year ago, actually. I was already here and my mother-in-law was also already here. And we visited, our usual doctor, and he told us that, it's probably going to take a surgery in her case. She had adenoids and she had, hearing losses. Her stomach was also iffy. Different things, but in general, it seemed to be as if there was allergic reactions to stuff. And the scarier part was not just the surgery itself, the fact that even after a surgery, it's possible it would come back, till the time she would turn out to be a teenager, because adenoids do tend to come back. So it was as if there would be a solution, a radical solution, but it would still not take care of the problem. And it was at that point that we walked in with Anoki here. And I want to share, I won't go on for too long, but I want to share 4 things. Actually, I thought about it on my way here. We live quite far away and, we thought we'd come here specifically for this. The first thing I wanted to say is that it's been a year, and just last month, Dr. Sankaran has said she can go off homeopathy. The recovery has been, quite remarkable. I don't think she's had, barring maybe a couple of episodes of cold and cough, she's had them. It's not as if she's had none. But they have, sorted themselves out pretty normally. And she's had very few of them. Okay, so we actually feel like we've stepped off that, treadmill that we were running on, all the while wondering she would have this or have that or go swimming. I mean, how terrible is it to tell a child to not go swimming? That's exactly what they should be doing. And she spent this summer and the last one doing exactly what she wants. I think we've lived on ice cream. I'm not suggesting everybody should. But the scary part of existence, a whole, existence has sort of gone away. The second thing I wanted to share is that, and I saw it, the mind, body, spirit bit. I can't put my finger on it. If you ask me what's going well, I can't put my finger on it, but I can certainly tell you there's a certain vitality, for lack of a better word. Okay, we walked in with certain issues, but if you just, if you'll ask me what do you feel as a, person who looks at her every day from the time she was born to today, there is that element of vitality that I see a step up in. And that pleases me immensely beyond the cold and cough, because that, I think, is the purpose of coming and getting better. The third thing is, a lot of people, I sit sometimes in the clinic, and there are so many people and patients who are walking in with children, and they're saying it's so hard with children. Homeopathy is so difficult with kids because you have this half an hour before, half an hour after, no water. I mean, why will children listen to you? When you're telling them, don't have anything, and at that point they'll tell you, oh, I'm thirsty. Okay? I don't know how many of you have had those experiences. And I used to keep telling them that just give it a little time. It settles into them. There are so many times when, in the first month is when it's a little tougher with children, because they're not grown up enough to realize, how do you schedule medicines and how to build it into their schedule. But there are many times my husband and I are traveling, and she's told her grandmother, okay, that I can't eat something for half an hour because I have to have my medicines. It's a journey. It's been a year, but I think it's fit into her, because, and I'll come to my last point, which is where I wanted to stop, which is that unlike other medicines and other experiences we've had, where, it's transactional. You finish with an issue, you get the medicine, you go away. I think homeopathy is involving. It gradually sucks you in a good way, into the health of people. For instance, right from filling up that form and asking your kid questions about how you sleep, you never really have those conversations ever. Okay, you don't have it with any other form of medicine. It's very symptom driven. To the fact that she herself, has gotten involved with, am I getting better? It's very early, but I hope that this is, the start of her involvement with her own health. It's an early beginning, but I hope that some of this will stay with her, because now as a family we are talking about her health rather than just symptoms and disease and, get better and antibiotic and treatment. So that really is, the sum and substance of what I wanted to share with all of you. And I have one, very, very serious last request of Dr. Sankaran, which is to invent or discover in his Materia Medica some therapy for good handwriting and cleaning up the cupboard. These are my two, requests. If that would happen, I think my picture would be a little more complete. Thank you.
Thank you so much. So we're talking about this kid, Anoki. Anoki, can you come up? You want to say something? Say hi.
Hello.
That's a healthy Anoki. Okay, Anoki. Thank you.
So, basically, very simple case from a homeopathic standpoint, no? Very simple remedy, calcium carbonate, and what miracle it can perform. The whole life changes. Every week, every 2 weeks, with antibiotics, with stomach infection, throat infection, adenoids, tonsils. And just within a month of starting remedy, things start improve. Within a year, she doesn't need anything anymore. Neither antibiotics nor even homeopathy. And this is possible to do in more and more percentage of cases when we get the right training. Everybody can guess, desire egg, this, that, Calcaria carb. But if you are not sure, the next attack she gets, you are going to change the remedy. You will give her phosphorus and sulfur, and after some time you are only confused. The way to be sure, to look at the symptomatology, to look at the genius, what is the type of person, to look at the sensation or the experience, where it fits the system. See that all of them come to the same point, and then when you give with that kind of certainty, you stay with the remedy for months and years, and then you see the changes. So all this requires training, knowledge, and that's the most important thing that we need to acquire. Good?